I'm Christy Duffy for Smart Trend News. The 7-hour bipartisan healthcare summit yesterday appears to have yielded limited, if any, progress toward drafting a bill that both Democrats and Republicans can agree on. President Obama urged lawmakers to try and find common ground throughout the discussion, but also acknowledged that, quote, it may turn out, on the other hand, there's just too big of a gulf. The very complicated debate covered the health care costs, lack of efficiency in the existing system, and the prospect of enhanced coverage for more Americans, not to mention the cost of the actual health care bill and what its impact on the deficit would be. A very good report in the Wall Street Journal today by Gerald Seib reports that there were 3 broad questions that cover the real source of division between the two parties. Generally, those questions and debates covered: 1, are we working for comprehensive sweeping change or incremental changes? Democrats want a comprehensive change, expanding coverage, restructuring the system, and lowering costs. Republicans feel one big bill that reconstructs 17% of the U.S. economy is risky and much too expensive. Number 2, is access to health care, or is the cost the reigning priority? Democrats say expanding health care for nearly all Americans would actually bring costs down, while Republicans say bringing costs down, then expanding coverage is the right way to go. Number 3, should the government or the market set the standards? Democrats say the government must first set minimum standards to help facilitate the sale of insurance across state lines, while Republicans argue that the market should delegate such things. Where the two parties agree, however, is that insurance companies should be allowed to sell across state lines, and people and businesses should be allowed to pool together to make insurance more affordable for all. For more news updates on this story, subscribe to our YouTube channel, Trade the Trend. You can also find updates on our website. That's www.tradethetrend.com.